Hello, everyone. My name is Berlin Bonifacio, and I will be introducing my research proposal titled Patient Adherence in the World of Athletic Training. First off, I am a certified athletic trainer working for Providence Health and Services, serving John F. Kennedy High School in Granada Hills, California. I earned my Bachelor's of Science in Athletic Training from Cal State University Northridge in 2017, and I am currently in the process of obtaining my Master's of Science in Athletic Training here at Fresno Pacific University. I provided the resources that I use for my presentation on the slide. Feel free to read through some of them as they are very interesting reads. So, what is patient adherence? It is when an injured individual complies to treatments or regimens given by any medical providers. For athletic trainers, we see patient adherence when they attend rehab sessions and follow what is recommended by athletic trainers. This may also include stretching regimens, coming on time to rehab, and other factors. It is important to understand patient adherence in order to give proper treatment to our athletes. Just a brief background of the overall problem. Data shows that roughly 30 million kids in the US are part of some organized sports. This may include football, basketball, soccer, hockey, or even track and field. Among those, more than 3.5 million kids sustain any injury during sports every year. Out of those injured kids, only 41 to 91% adhere to rehabilitation. Although 91% is high, it is important to know why a lower rate of adherence exists. According to previous studies, some of the strategies that can improve adherence include education, meaning us athletic trainers teaching what adherence can do to the outcome of their rehabilitation, or telling them the purpose of why they are in rehabilitation and why adherence is important. Communication and rapport. It is important that we communicate with our student athletes in regards to their rehabilitation. We also need to build this relationship in order for them to trust us. Another strategy is having social support and encouragement. This could be from their teammates, their coaches, or even their family members. We also need to set goals and attainment when doing rehabilitation with our patients. Sometimes them seeing that they are improving helps them a lot in adhering to their rehabilitation. Treatment efficacy and tailoring is also important because if the patients does not see that they are improving, sometimes it does not make them adherent because it discourages them that they are not doing anything useful by adhering to their rehabilitation. Athlete responsibility is a very important aspect as well. They need to be responsible with their bodies, and with this, they need to be adherent to their rehabilitation. The more they are adherent, the more or the better the outcome will be in regards to their rehabilitation. Another strategy would be threats and scare tactics. Sometimes we need to scare our student athletes that if they are not to adhere to the rehabilitation, it could cause a bigger serious problem in the long run. The purpose of the study is to look at what affects adherence of student athletes who have sustained injuries. We will be looking at two factors specifically. Is adherence caused by situational factors such as social support, coping mechanism, scheduling conflicts, or etc.? Or is it because of personal factors such as pain tolerance, ego, the thinking that they need to be tough and not show weakness, or motivation? I have provided in this slide other examples of what situational factors and personal factors entails. From the previous research studies that I found, they focus on which factor affects adherence. As for my research, I would want to look at both factors and determine whether situational factors has greater effects than personal factors. An example of this could be, does support from teammates make an athlete more adherent to his or her rehabilitation than self motivation? For this research, we will include 50 student athletes who have sustained an injury that will require them to stop athletic participation for at least 2 weeks. Since we will be focusing on the high school athletic population, the mean age of these participants will be 16 years old. For this study, we will be using the Rehabilitation Adherence Measure for Athletic Training, also called RADMAT, and the Rehabilitation Adherence Questionnaire. These measurements, or mode of measurements, covers questions such as attendance, communications, and attitudes. I also forgot to mention that this study is considered a qualitative design, meaning that this study entails a lot of phenomenon that cannot be explained using numbers. The procedure of this research will be, each of the following students would be evaluated by an athletic trainer and be determined that they need to sit out from participating from any sports. Each athlete will be evaluated by the same athletic trainer using the RADMAT, and the students themselves will answer the RAQ. Each evaluation paper will be collected by the end of the week and be added to the data collection. So now the question is, why would this research be important? This topic is important for athletic trainers and other medical providers in order to have a better understanding of what can affect adherence among our injured athletes. With better understanding, we can build a better approach towards treatment, which can improve their adherence and lead to a better outcome from their rehab. There are still a lot of research that needs to be done in regards to this topic. Although this research will be a good start as an eye opener for providers to see what can be done on our part to increase good outcomes for our athletes. I hope you guys enjoyed this presentation and don't hesitate to ask me any questions about this topic.